Introduction to Veterinary Chemotherapy. You have 10 to 20 seconds to answer depending on the question. Ready? Go. 1. It is the greatest contribution of the present century of therapeutics. Answer B. Antimicrobial drug. It is also dubbed as the most frequent used and misused drug. Number 2. Known as the father of chemotherapy and coined the term chemotherapy. Answer D. Paul Ehrlich. Number 3. Penicillin can be obtained from the Answer B. Mold. It was obtained from the penicillium mold discovered by Alexander Fleming. Number 4. These drugs can inhibit protein synthesis except Answer C. Penicillin. Penicillin can inhibit cell wall synthesis but not protein synthesis. 5. Based on the spectrum of activity of antimicrobial drugs, erythromycin is considered as B. Broad spectrum. 6. Successful chemotherapy is based on the following principles except Answer D. All of the above. Presented on the screen are the principles of chemotherapy. For numbers 7 to 10, read the statements presented on the screen. Seven to 8, write A if the statement is true, otherwise write B if false. For number 7, answer the following questions. Answers. First one is false and the second one is true. For number 8, answer the following questions. Answers. Both of them are false. 9 and 10. Choose two correct answers. Answers are E and G. For numbers 11 to 12, choose the best answers. Answers are A and C. All of the statements above are correct. Number 13, it is the development of new infection in the patient due to the use of AMA for chemotherapy, but most common when using broad-spectrum AMAs. Answer C, superinfection. 14, the insensitiveness of microorganism to an AMA is called Answer B. Microbial drug resistance. Next question, most widely used AMA in veterinary medicine. Answer A. Sulfonamides. Main reason would be because of their relative efficacy and their low cost. Next, a long-acting drug is Answer B. A long-acting drug is highly absorbed but slowly eliminated with 4 to 8 hours duration of action. Number 17. This is used in treating eye infections. Answer D. Mefenid. 18. According to the principles of sulfonamide therapy, sulfonamides should be Answer C. Should be given at a higher dosage, IM or IV in severe infections. These drugs interfere with bacterial cell formation by interfering with transpeptidation or by inhibiting transpeptidases similar to penicillins. Answer A. Cephalosporins. 20. This drug is combined with celestine and is used in serious hospital-acquired infections, particularly in immunodepressed patients. Answer A. Carbapenems. 21. A highly effective broad-spectrum antibiotic that can cause severe blood dyscrasias in humans, carefully used in animals and not approved for usage in food animals. Answer A. Chloramphenicol. 22. Erythromycin was obtained from Answer A. Streptomyces erythraeus. Number 23. Restricted in infections caused by susceptible gram-positive bacteria including Staphylococci, Clostridium tetani, Clostridium perfringens, Rhizopilothrix, Actinomycetes, Nocardia, and certain strains of Mycoplasma pneumoniae. Answer B. Lincomycin. It is due to its serious toxic effects. 24. A semi-synthetic derivative of number 23's answer. Answer C. Clindamycin. You have 2 minutes to answer the next question. Answer D. All of the statements are incorrect. 26. Thiamulin was obtained from. Answer C. Pleurotus mutilis. 27. Bacitracin was obtained from. Answer D. Bacillus subtilis. 28. Virginiamycin was obtained from. Answer A. Streptomyces virginiae. 29. Thiotyrazine was obtained from. Answer B. Bacillus brevis. Number 30. Based on spectrum activity, this drugs belongs to the broad spectrum, except. Answer C. Streptomycin. Number 31. These are chemical substances that suppress growth, multiply, and kill microorganisms in a very low concentration. Answer C. Antibiotics. Number 32. Which among the following drugs is safe for pregnancy? Answer D. Penicillin. Number 33. It is the development of new infection due to the use of AMA in chemotherapy. Answer D. Superinfection. Next, which of the following agents are narrow-spectrum antibiotics? Answer C. Tetracyclines. For numbers 35 to 40, true or false? 35. AMAs with high margin of safety must be used very cautiously when renal and cardiac functions are defective. Answer B. False. It should be renal and hepatic functions. For number 36, answer A. True. 37. Newborns cannot metabolize and excrete chloramphenicol because of deficiency of metabolizing enzyme and cause fatal blue baby syndrome. Answer B. False. It should be gray baby syndrome. 38. Bacteriostatic drugs will be less effective on very young, very old, and debilitated animals because of poor or impaired host defense. Answer A. True. 39. Bacteriostatic drugs cannot cure an infection in a patient with a normal defense status, but a bactericidal drug must be given in a patient with impaired defense. Answer B. False. 40. Antibiotics, especially penicillins, produce severe life-threatening anaphylactic reactions in men and sometimes in animals. Answer is true. This is the reason why animals with any history of allergy should not be given AMAs. Number 41. It determines the choice of AMA and its route of administration. Answer B. Location of infection. Next question. Products containing viable, non-pathogenic microorganisms administered orally to alter the intestinal microflora. Answer C. Probiotics. 43. Non-digestible substances which stimulate the growth of intestinal flora and thereby prevent the colonization by pathogenic bacteria. Answer A. Prebiotics. Number 44. Were effective AMA to be used systemically in man against pyogenic bacterial infections? Answer D. Sulfonamides. Next question. Sulfonamides are Answer B. Bacteriostatic. It is an agent that prevents the growth of bacteria. Number 46. This or group of synthetic antibacterial compounds which contain a furan ring to which a 5-nitro group is attached. Answer C. Nitrofuran. 47. A group of synthetic antimicrobial agents. Nalidixic acid is the older agent in the group. Answer quinolones and fluoroquinolones. 48. It is a second-line medication for the treatment and prevention of pneumocystis pneumonia and for the prevention of toxoplasmosis in those who have poor immune function. Answer B. Sulfones. Number 49. The physical and chemical properties, especially solubility of penicillins, are related to the structure of Answer D. Acyl side chain and cations used to form salts. 50. Dosage of penicillin G, the natural penicillin, is usually expressed as Answer B. International units or IU.